My journey into geriatric medicine started pretty early. It started before I went to medical school. And the reason for that is because of my mum. Not because she was a doctor, but because she ran the local Derby and Joan, which is the social club for older people. And watching her do this, I realised that a lot of older people are disenfranchised and in many ways excluded from the workings of normal society. I mean, a good example is that for a lot of her members, the only time they left their homes each fortnight would be to visit her social club. And that taught me that the lives of older people are often unnecessarily narrow. So I was drawn to geriatric medicine because it offers you the challenge of being a good physician, whatever that means. But it also asks for a great deal more. It asks for you to understand what medicine can do for people, but also asks you to understand the limits of what medicine can do. But perhaps more importantly, it challenges you to understand in some detail the people you're helping. That's the only way you can hope to care for older people well, by having some insight into the lives that they live, the lives that they have left, and what their ambitions are for the time they have remaining. And that struck me as being challenging, varied, and a rewarding way to practice medicine. And I'm glad I did, because it's proved to be all of those things and a very great deal more. This book is for people curious about old age and the issues that really make a difference to the quality of life of older people. I try to illustrate each theme with a little story drawn from the people I've met in real life to bring the discussions I talk about to life. This is to give it relevance and resonance to healthcare professionals from across the multidisciplinary teams who work with older people and those with frailty. And it's aimed to appeal to curious professionals from any background, really. It's also meant to appeal to older people themselves, those who want to continue to challenge themselves and understand better one perspective on old age. I mean, I don't claim to be the definitive voice on ageing. After all, I haven't lived it yet. But I ask questions and make assertions which are aimed to illustrate the realities of old age and trigger curiosity. Not everyone will agree with me, and that's fine. That would be no fun at all. The idea for writing this book came after a pretty intense 5 or 6 year period when I'd been working in Dorset on establishing ways of caring for older people closer to home. I was really proud of the work we'd done and the difference it had made to the patients we care for. I think it was also really profound, the impact it had on staff who were really engaged by the possibility of shaping the way we deliver care around the needs of patients. And I think for many of them it approximated much better the ambitions that motivated them to do the jobs than anything they'd done before. And so I wanted to kind of share what we'd learned from doing this, because it seemed to me that something really important had come out and it would be selfish to keep it to ourselves. It was also a personal challenge for me to kind of collate where I'd got to in my understanding of looking after older people. And I thought there was an important message to be drawn out from that. And I think what is really important is the understanding that fundamental to our ability to care well for older people is our willingness to let patients define for us what we're trying to achieve. Good care involves, I think, necessarily incorporating the needs and ambition of the people you're treating into clinical decision making. And this isn't always easy, but it is rewarding. Older people, particularly those with frailty, often have really complex needs, and it can be a real challenge to figure out what's possible. One of the things we learned is that this complexity often melts away when you start to involve patients in decisions around their care much more centrally, by understanding who that patient is, what it is they want to achieve, and really work to give them their voice in articulating what success looks like. I often say to people it's impossible to say from the outside what good looks like for an individual person, as it varies so much. I mean, some people that you meet do want you to do everything for them to keep them alive for as long as possible, but in reality, they're relatively rare. But what people do ask for varies hugely. Some people want to be in less pain, some people want to breathe a little easier, other people want to live long enough to make it to their granddaughter's wedding, or be at home with their cat, or spend as little time talking to me as possible. And it's until you spend the time understanding what it is that they want, what level of risks they're prepared to take, what their natural style is, you'll always be guessing at how you can help the best. And I think this is the important lesson. There is always scope for excellent medicine in older people, but it's only ever one part. I worry that too much focus is spent on the medicine in old age and not enough on understanding how we can help people live better lives. And I think this runs into a wider trend that we risk, in that we see old age as a medical problem in search of a solution, rather than a natural phase of life which we ought to positively embrace. And so this book is a summary of what I and we learned from the work that I did in Dorset, and extrapolations from there. There's a few things I'm trying to achieve with this book. The first is to overcome a natural sense of diffidence and share what I've learned about looking after people in their own homes with both other health professionals and older people alike. I mean, I'm indebted to many of my patients for what I've begun to understand about old age, and they've shared their wisdom with me freely and generously, particularly those I saw at home or got to know over a period of time. Secondly, I want to start to paint a positive picture of old age. We have a tendency to celebrate youth and treat aging as a regrettable process of decline. Yet throughout our lives we are always changing. I don't think we ever remain the same person for very long. And it's too easy to look only at what one loses in old age and view it as a time of loss. But that's too simplistic. There's good evidence that contentment rises with age, with the most miserable time of life being in one's mid-40s. And I've met so many older people who are genuinely happy and contented, and I don't think we listen to what they have understood enough to benefit ourselves. I mean, these are people who adapt to changes that have accompanied them with old age, and focus not on the things that they can't do, but instead on the things they want to do, and they work out how they can continue to do them in the context of the way they've changed. And it's this view that's led me to the realization that one of the big challenges we face in creating a positive old age for us all is our failure to accept what old age is and plan for it accordingly. There's good evidence, for example, that when older people and younger people work together or interact regularly, everyone benefits from the contact. Yet we design out such interactions from our daily lives. Older people live separately. Older people suddenly retire from the workplace and disappear. And we do not allow for a positive contribution by older people in a way that would benefit everyone. I really struggled with this question because it's a bit like being asked to choose one's favourite child. But if you're going to make me put my head above the parapet and commit to one, then I would encourage people, if they are only going to read one chapter, to read the chapter on assisted dying. And this is not because it's an issue I'm definitively right about. In fact, I'm not sure it is an issue anyone can be definitively right about. It's also a chapter I was really nervous about writing and took a great deal of time over, because it's a subject associated with really strong emotions and views. But I think it is also a chapter that stands well on its own as an example of how we sometimes need to shape our thinking around the specific needs and circumstances of older people. And this reflects a broader truism that if we want to offer good care to older people or experience positive lives ourselves in old age, then we need to anticipate and acknowledge the challenges and opportunities that accompany old age and deal with them directly. I think also this is a chapter that reflects the balance I've tried to strike throughout the book. I'm writing about a topic for which there is no definitive or objective truth. I'm sharing what I've learned over time in working with older people, And all of those views are subject to change, but I hope that it provides a good framework for people to ask their own questions and shape their own understanding of the key issues in play.